So George, we made it to the normal place to do a video. I accidentally hit the end button on the live we did a little bit earlier in the treatment room. But like I said, my car was going thump, 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 thump. Like there was something going crazy on the front end. So I thought maybe the alignment, something with the front end was just letting loose, and it scared the living heck out of me. Then I was grateful to see you a little while ago, because how out of alignment was I when you saw me?
You really needed to be treated, and that gets to the title of our video today. Life happens.
And life does happen.
And ironically, what this sequence of events has led to is a near fender bender for my good friend here.
Very near.
And it brings to life, or to light, my fender bender of December 14th of 2021.
How many months already? That's
At 9 months. So he had a near miss, and he still had some significant functional deficits, which obviously it was mechanical, so it's very treatable,
right.
And he should have a very favorable outcome. And we did some therapy, a combination of therapy and manipulation, and a couple different types of manipulation. And I want to talk about that a little bit. So I'm 9 months out from my motor vehicle accident, in which my vehicle is totaled.
That was what, about 40 miles an hour? T-bone?
30 to 35.
35?
I was going, she was probably going more, but I was going about 30, 35, and then all of a sudden she was there. I hit the brakes, but I remember thinking to myself, I'm dead. You know, but I'm here to do this video and to talk about it.
Thank God.
Thank God. I was really dazed. I was probably out of it for 5 to 10 minutes. I'm not even sure how long. But getting back to that, I sustained injuries, and part of the problem, or the cause for those injuries, were my airbag didn't go off. And I had my seatbelt on, which gave me impingement syndrome in my left shoulder, the left side of my neck, and in my whole left arm. And we're 9 months out, and I'm significantly better. I just got evaluated this past Thursday.
Right.
And I have improved range of motion, improved flexibility, improved posture. I have reduced symptoms.
Now,
However,
what have the medical world done for that? Hey, take this medication and come back.
I didn't go that route.
Right.
I went to a DPT, a doctor of physical therapy, and I went to my good friend, Dr. Carl Muller, who's a rehab chiropractor, and he was also doing mechanical traction to me among rehab, and I was getting soft tissue stabilization and soft tissue treatment done. So basically, I was getting mobilization from the chiro plus rehab, and I was getting stabilization plus rehab from the PT.
Right.
And I was being evaluated by two of my good medical doctor, two very good medical doctors. One is board certified physiatrist, a doctor of physical medicine in the medical world, and the other one is also board certified in physical medicine. And they're the ones who originally diagnosed me, and you know, all that being said, I didn't go the medical route in that I didn't do the pharmacology. You know, you had different choices, but if you look at like the studies from the American College of Pharmacology, from the American College of Physicians, and you look at all that, they recommend against that, believe it or not.
I do believe it.
And you know, so I went the non-pharmacological route, and I did PT, I did chiropractic, I got evaluated by the medical profession, and I went to the gym twice a week.
And you were able to keep seeing patients, you were able to keep working through it.
But with everything, there's always good and bad. So the good is, I'm here to talk about it. The good is, I'm significantly better, but there's always a but. You know, for everything good, there's always something that's a little detrimental. The detrimental problem is we're 9 months out, and I still have residual symptoms that are on the base of my neck, in my left shoulder, specifically the rotator cuff and AC joint impingement syndrome.
Right.
And apparently, what really irritates it, like I have zero-turn mowers, and I've tried to cut grass, but I could last about a half hour, 40 minutes, and it just flares up the symptoms in my left shoulder. And what's happening is it's my infraspinatus from steering my zero turns. Unfortunately, you just perpetually can't keep going straight.
Right.
Sooner or later, you got to turn.
So you just have to hire Cindy to cut the grass.
No, actually, a patient of mine has cut the grass the last 6 times. I mean, I tried to cut a little bit, it just didn't work out so well. But going back to all that, I've had to adapt. Besides missing days from work, and I missed days from work where I just couldn't work. And I had psychological issues. I had to have my wife drive me around for a few weeks because I just couldn't drive.
You had PTSD from that.
I did, and the problem with that is I have a photographic memory. The problem with everything that's good and bad, the problem with the photographic memory, I kept having visions of the collision. And all that being said, and trying to do things, I couldn't golf, I still haven't golfed, and here we are, it's August, and I haven't even swung a club.
Well, you can play golf video games.
Yeah, there you go. But the bigger part to that is, besides missing time from work, not being able to golf and do a lot of the things I like, the biggest problem with that is I had to adapt the way I treat patients.
Yeah.
I just can't do those double thenar adjustments anymore. I could do anything with my pisiforms. Like I could do thoracic with pisiforms, I can do lower back with pisiforms, I can do lumbar rolls with pisiforms. I just can't do anything with my thenar, which I used to do. So I could do any prone cervical adjustment, but I can't do any supine cervical adjustment or sitting cervical adjustment because of my left hand. It's rather unfortunate, and I have some functional deficits there still 9 months out. So I find myself, I have an impulse, I have an activator.
Yeah, you have the tools to work.
I have an arthrstim using devices to adjust. I have a lot of high-tech equipment here, and I have a lot of rehab, and you know, it's just one of those.
Life happens, my
Life
friends.
happens. So here I am,
and the obstacle,
with my good friend, where life happened to him.
The obstacle is the way. We just keep dusting off and moving forward. There's always an answer. There's always a solution. Whether it's getting to a healthy weight, whether it's learning new habits, whether it's learning how to treat patients with different modalities because your body is not capable of certain techniques.
What's ironic about that is I have patients now tell me I'm actually a better adjuster.
See that? You never know.
I adapted my ways of adjusting, and they tell me I'm actually better.
There you go.
So it could be worse, I guess.
Yeah.
And getting back to everything, I was able to see him just hours after it happened. So the sooner you see somebody when those types of life events happen, the better you're going to respond. The better chance you have for a favorable outcome, and bouncing back.
And the beautiful thing is, trauma will happen in your life. You're going to sprain that ankle, you're going to twist that knee, you're going to wrench that back. You're just going to do things. It's a natural part of either being clumsy, overtired, overactive. Life just happens. I mean, my poor wife, she stubbed her pinky toe into a bar stool for all things and had a little chip fracture. Life happens, but the more deflamed you are, the more you are at a healthy weight prior to going into trauma, the better your outcomes are going to be.
And I wanted to talk about that. So prior to my motor vehicle accident, 2 days before, I was out to eat with some friends of mine, and I had remarked to Carl that I was feeling 10 and a half, this was the best I felt in 10 and a half years, and I was feeling, you know, significantly physiologically younger than my chronological age. And I had started following David Seaman's Deflame Diet. I modified a little bit. I had a lot of discussions with David and you know, with Bob. And speaking of Bob, and my wife bought me one of those because I want to touch on that a little bit.
Gotta hydrate.
But I had a lot of conversations with Greg Cook out in Scottsdale and Phoenix, Arizona when we were out there for a symposium. And I took all that, put it together, and modified the D-Flame diet a little bit, eliminated sugar and gluten, and here I am.
That's huge.
And with that, I was showing Bob today, before we got on this video, I was looking at pictures of myself on Facebook, and I'm showing him. There's a picture on Facebook where I'm with my sister where I look really sunken in the face.
A little too thin.
Too thin. And I dropped below 190. I was probably in maybe 185 in the 180s. And then I had my wife told me I looked bad, so I intentionally gained some weight
told
back.
Me that too.
Yeah, ironic, right? How can you be too thin? But I guess you can be. And so I intentionally gained some more weight back by eating more protein and working out a little more. And right now, as we speak today, I'm at 200 pounds. And a good friend of ours, and Bob was at that office today, right when he called me when this happened to his vehicle, at Mary's office, Mary Rakowski, a very good friend of ours, another chiropractor in Center Valley, Coopersburg, Center Valley area.
Yeah.
And, Mary had commented to Bob the last time that he was in my office that I was starting to look a little chubby. So with that in mind, I started looking at videos and thanking Mary for pointing that out. I look better in the face.
Find that Goldilocks.
I gotta find that happy medium.
You gotta get to Goldilocks.
So when I started looking at a lot of pictures, I actually looked best when I was around 195. So right now I'm at 200, so I want to drop about 5 pounds. And I'm going to start going to the gym with my wife. We just joined Planet Fitness up in Allentown at Tillman Street.
There you go.
And we got the Black membership, which is $24.95 a month. It gives you access to everything. And it's open 24/7. And I'm going to continue to follow the diet. Bob brought me some supplements today.
Some good anti-inflammatory
And I'm going to
nutrition.
continue to take the 30 supplements a month I take. I'm going to continue to follow that modified D-Flame diet. And I'm going to incorporate exercising, because I stopped exercising a little bit because the facility I was going to was having a cleanliness issue.
Ooh.
And so my wife and I
Gross.
quit that facility, and we now joined Planet Fitness. And while we were at Planet Fitness, there were 4 or 5 people there cleaning as we were joining.
That's a good
I
sign.
was so impressed, and everything is brand new, and it looked really great. It's out in Tillman Street, where the Kmart used to be.
There you go.
So I think I'm going to just reshape myself back to that ideal weight of 195.
Listen, you know what to do. You have the habits
Have
installed.
the training and the education.
You know what to stick in here, and
Been there, done that.
and this is you're clear on what you want to do and why you want to do it. That's the most important part.
And I have the proper mindset. Mindset we've talked about, Bob and I have talked about a lot, is you got to have proper mindset. And if you don't have mindset, you got to develop mindset, and you need people like Bob or I to coach you.
Listen, whatever it is you want to do, you can go alone and get it done. But if you're struggling trying to get it done yourself, the puzzle's already been solved. And someone like myself, someone like George can certainly help get you there a little bit quicker, with a lot less stress.
So let me just say one thing in closing, since Bob has his shaker bottle here. And I have one at my office, right over there, that I take electrolytes in, and then I fill it up again with water and lemon water. And I've drank already today 64 ounces of water. And unfortunately, I dehydrated myself in heat because I was under the misconception, I'm in my pool, I'm cooling down. And then I went and had some beers, probably not a good choice. And then I went out to eat with some friends and I had coffee. And I had it took me 3 days of electrolytes to recover from that. I had to drink some Sunday night, and then twice I had to do electrolytes, Monday and Tuesday, and then once on Wednesday. So it took me like 2.5 days to recover from that. But I just want to reiterate in closing how important electrolytes are and hydration, because hydration gives you pliability. That's according to Tom Brady's research and the Tom Brady program, the TB12 program. Pliability is the ability to repeat an action over and over again without injury. And his secret to pliability is hydration. And I just want to reiterate that my wife was so into that, and she's a big Tom Brady fan. That's her favorite player.
Well, he's a hunk.
He is. And he's playing again for the Tampa Bay Buccaneers. I'm sure he'll play well. And, you know, anyway, she went out and bought me another shaker bottle for at home, and she bought me electrolytes for at home, so I could not only hydrate at home, I can hydrate here.
George.
I have supplements at home, and I have supplements here.
She loves you, George.
She loves me.
Who doesn't love George? Everybody loves George. Anyway, if you're looking for a good chiropractor, and you're in the, Pennsburg area?
I'm 5 miles from the Quakertown exit of the Northeast Extension.
My buddy here.
Right next to St. Luke's on 663 in Garyville Pike.
I got an awesome adjustment. Life happens. Thankfully, the front tire didn't fall off the car. 3 lug nuts loose. Shaking like a crazy mama. And almost had a little collision to boot. It was a scary touch and go moment. But we keep moving forward no matter what.
The big difference is I practice evidence-based and I look at function as opposed to what a lot of my other colleagues do. And the other thing I do differently is I focus on active care, and I don't let people develop that negative mindset or that, you know, anxiety and stress over, you know, where they get in like you got in a near fender bender, but you're feeling pretty positive about it and you're okay. But what happens to people?
Always a good sign.
Well, what happens to people sometimes is they'll look at that and they'll stress out about it and they'll have anxiety about it and they catastrophize.
Oh, sure.
And what happens with that is by doing that, they reduce their chance of a favorable outcome and they prolong treatment. So the better mindset you have, once again, and Bob and I always talk about this, the better outcome you're going to have.
Is life happening to you, or is life happening for you? Let life happen for you. Be positive, have a good outcome. George, I think we spoke way more than we should have.
But it was fun as usual. And everybody out there, have a great day and look for us again. We'll be back.
See ya.
Take care.
See ya. Enjoy.